Okay, that's great. So what we are looking at is this particular second learning outcome in the unit, which is safeguarding in particular. So I'll just switch you over to what we have in terms of the unit spec and the assignment brief. So we started this unit last week, and what we're going to do is obviously do a bit of a quick recap on learning outcome 1. Now, principles of safeguarding, and obviously safeguarding when we started to study, essentially tends to be a very important topic, within health and social care sector. So if you recall what we discussed last time, in particular in relation to safeguarding refers to the action to protect individuals, people who are vulnerable, children in particular, and people who can be subject to abuse because of, or can be harmed, let me put it this way, or could be put in the harm's way. And this would be primarily through 3 different routes. One is abuse, second is neglect, and the third is harm or exploitation. So we looked at in the last session, if I just scroll down briefly, in the last session in learning outcome 1, we covered things like what are the signs through which we recognize that there is abuse, neglect, and harm or exploitation happening. So we looked at 10 different types of abuses, which included things like bullying, emotional abuse, financial abuse, institutional abuse, which is basically abuse happening at the institutional level. So we've seen a few panorama investigations over the years wherein a lot of care homes have got closed down because the patients and the residents have not been treated fairly by the staff. And that has been an example of an institutional abuse. Neglect by others. People sometimes get neglected, by their family members and obviously friends and near dear ones. Even local authorities can be subject to, investigations by neglect by, in terms of some sort of an abuse which is happening because they've neglected their responsibilities. In Haringey Council in particular, we had a case a few years back wherein the chief executive had to resign, and there was a serious investigation, and that was an example of neglect by others. And in this case, obviously, the local authorities which are responsible for providing safeguarding and social care services to members of public. We have physical abuse, psychological abuse, self-neglect, and also sexual abuse. Now, safeguarding includes a range of activities which could be implementing policies, procedures to ensure that safe practices, training of staff, and also, looking at volunteers, which are basically involved in providing some of these services, follow these safeguarding practices. And they basically, when they follow these practices, what they are looking at doing is they're reducing any abuse, neglect, harm, or exploitation which is happening or can happen in the system through the agencies, and even with people involved in delivering these services. And that is where the principles of safeguarding establish reporting mechanisms, essentially, which could help us raise concerns of incidents or raise concerns of abuse. And in this case, it helps make sure that the services being provided are proper and are meeting the requirements set by CQC or some of the other bodies. Now, when people are involved in safeguarding, there is a proper background check which happens. There are risk assessments being done, and we looked at 5 videos that we looked at in the first learning outcome. If some of you remember, there was one video wherein a single mom used to leave for work, and the child, 5-6-year-old, used to be left behind in the house, and she was talking through the post box, door. Through the door, she was talking to the post box to the members which had come in from social services, and that was basically ensuring that and then obviously the member raises the concern with the local authorities to say that she might need help, and obviously this could lead to children being depressed or getting into a spiral where they can get into self-harming themselves, and all those things are a part and parcel of risk assessments. And obviously sometimes these risk assessments would lead to then providing additional support and care for those who are needing the most in the society. So safeguarding in general that we covered in the first learning outcome emphasized, after we studied the following types of abuses, 10 different types, and we identified the signs and symptoms of 3 of those abuses out of the 10 that we studied. So in the first learning outcome, we understood that why is safeguarding important. who has the responsibility of safeguarding individuals and individuals within the organization when we talk about responsibility at the organizational level, and that is to ensure that people, children, vulnerable adults are not put in the harm's way. That means they are not subject to abuse, neglect, harm, or exploitation. And this would help promote a culture of respect and dignity in this society, thereby ensuring that all individuals which require social services or require care in some shape or form, whether it's clinical care, adult care, mental health care, or patient care, they are basically then being given the care which is provided as per the quality standards, and ensuring that the individuals essentially who deliver this care or are involved in the process of delivering this care can basically be thoroughly vetted, and people who are receiving it can absolutely feel confident that they are in the hands of people who are trusted, reliable, and thereby they will not be put into harm's way or subject to or open to any sort of abuse. So safeguarding tends to be a very, very important topic. And what I'd requested everyone to do is, in the first learning outcome after that, I'd asked everyone to go into the SCIE website, which is the Social Care Institute of Excellence, SCIE, and in that basically read the chapter on safeguarding, which was about a 10-minute read. So I don't know how many of you went ahead and read that chapter, but if you have, then obviously in this case, that would allow you to understand what we covered in a lot of detail during the first learning outcome. Now, what we want to do and cover in today's session is we want to understand how you respond to incidents of harm and abuse in general with regards to action that needs to be taken by social care workers or people who are working within the sector and are responsible for, safeguarding individuals who are either children, vulnerable adults, or people who are needing support and are, obviously needing support in terms of care services. So let's look at a presentation and a few slides that I've got together for this particular topic, and that would help us cover this particular learning outcome in a great amount of detail. So these presentations are up on Moodle, and you should be able to read them beforehand to join the session, which will allow us to have a bit more discussions or, do a bit of question answering sessions related to the topic. Now, some of the key terminology that I want to bring across, as always, before I start and get into the details of discussion is, how do we respond to abuse? One of the things is, yes, we understand that there are instances of, abuse and harm which can be done, but how do we look at respond to abuse? So when you look at responding to abuse, we are basically looking at here to note very carefully reactions or, symptoms essentially, which can lead or give you a prompt that there is abuse happening with a particular person or, the person is being subject to abuse. So here, reactions to violence, or when you look at reactions to, say, for example, repeated violence, which is happening, and those could be visible scars. So we looked at another example in the first learning outcome when obviously the mother spanked the child, and obviously the child, when he went to school, had bruises on his arm. And when the teacher inquired, he said that I fell down. But on further investigation, they raised an alarm, and that, obviously the lady was, or the mother was then put into parenting classes in order to understand how to manage children. So when we look at repeated violence and when we look at these signs and symbols of violence which is happening, that is where you would raise an alarm. And then obviously that alarm would be raised with relevant authorities, which would then look into it and respond to if there is an abuse happening. Now, there are various examples of, how to respond to abuse. So when I talk about respond to abuse, we are looking at, in some cases, staying calm. There were a couple of points which were there in the last presentation, which basically said that if you notice abuse and if you see that there is systematic abuse happening, then what you need to be able to do is stay calm and obviously ensure the safety of the person first. And when we look at safety of the person and ensuring calm, what we are also doing is at the same time making notes of what we are observing. So it acts as an evidence at a later date when it needs to be produced, as evidence. So what we have to do is sometimes there are hidden symbols and conversations which basically also give us clues. And that is where we also need to look at listening attentively, so that we know that the person might be talking to us in a context wherein they would not be, and because they are under subjugation or because they're under pressure or they're facing violence, they might not be able to openly talk to us. And in those cases, what you have to do is listen attentively and look at, let's say, look at signs of how, the person is actually trying to convey the message. Recording is a key part of it, to ensure that at some date, at a later date, when times, date, location, or, the type of abuse which is happening is noted down, and is noted down as a part of relevant evidence which can be produced. The other bit that we need to do very importantly is, when we look at responding to abuses, we are looking at reporting the incident to appropriate agency or people involved, so that they can follow the actual protocols and procedures, and in some cases bring in law enforcement agencies or child protection agencies, or in fact, in most organizations now, even in our college, obviously we have a safeguarding policy, and there is a designated safeguarding officer. So if you have concerns, if you have let's say issues wherein you feel that this person or a person is subject to abuse, harm, or neglect, then you can raise an alarm with the safeguarding officer, which is a designated person within an organization. And that would be the first line of respond to, say, for example, going, responding to abuse, or observing and then responding to abuse which is happening. There are lots of steps that we can take in terms of how we can respond to abuse, but generally they tend to be about 4 or 5 areas that we need to look at very carefully. And they, if I summarized, would tend to be things like listening, to people attentively. We are looking at staying calm. We are also ensuring that we are making record of anything that we note which is not normal, and also ensuring that we are then at the same time informing relevant authorities and people who would be in charge, or who would be charged of, taking appropriate action. These steps that we take, can prevent abuse, and can be steps which are going to be very effective in order to respond to abuse which is happening within an individual, or within an institution, or within a particular setup. And this would then be, the ways in which we would generally look at responding to abuse. Sometimes it is also recommended that if you are new to this particular, area, and you need more guidance and information, then it is advised, and it is suggested that people go through the safeguarding policy and seek guidance from relevant people within the organization or agencies, who are then going to train them to be able to understand, spot, and then respond to abuse wherever possible. Now, there are 10 different types of abuse that we discussed in the first learning outcome. Do you recall any of them? What were the different types of abuse? Just as a quick example. Anyone?
Domestic abuse.
Yeah, domestic abuse. That's one.
Sexual abuse.
Yeah, that's correct. So when we look at different types of abuses, we also look at one of the things which I've brought across is emotional abuse, because this is an abuse which basically talks and starts through intimidation. That means you're looking at threatening somebody, you're looking at shouting at somebody, you're showing aggression towards somebody. And this could be done by basic things like name calling, or in some cases shouting. And this then tends to create what is called emotional abuse. And emotional abuse is all about blaming, scapegoating, and also, in some cases looking at using sarcasm, which means you say something, but you actually are meaning something else. And this would be, systematic ways of basically dealing with somebody psychologically, and that would be termed as emotional abuse. Now, what are the things that we also need to do, and what we will also study in this learning outcome will be to look at what are the 6 principles of safeguarding. Now, these 6 principles of safeguarding, I've just written the words down here. They include things like empowerment. That means people should be empowered to be able to make decisions, understand the information, and should be able to get information freely as and when requested. Prevention, There is proportionality. That means things have to be applied in proportion, and they need to be done in a way wherein people do not feel that they have been disadvantaged, and that is where proportionality comes in. You need to look at the whole aspect of protection, and that's maybe the core idea behind safeguarding. When we look at partnerships, essentially, because in health and social care services, we normally see these services being delivered through private-public partnerships, contractors, various sets of different types of people working within the healthcare services, agencies involved, and that is where partnership needs to work, so that work or care can be delivered seamlessly. And it should not be a case wherein the agencies or people work in isolation and say, okay, I've done my job, but nobody then connects the dot, and that is where partnership needs to work. And then accountability, the whole idea of having a safeguarding officer within the organization, and ensuring that somebody is responsible as a custodian for compliances, for legislation, and to ensure reviews, risk assessment, risk mitigation is done, would be the accountability aspect of it. And we will look at some of these in a bit more detail. Now, let's look at a short video. What I would want to do in that short video is basically showcase the video in terms of how do you report concerns of safeguarding. And the reason I would want to do this is because this video, which is basically a video produced by the NHS, here the NHS director is essentially explaining very briefly in terms of how do we report concerns about safeguarding itself. So one is that we know that there is abuse happening, but the other is we know if there is safeguarding implemented within the organization, and if it is not working, or if it seems that the safeguarding is there, but it is only on paper and it's not being practiced within the organization, then how do we report concerns about the whole process of safeguarding itself, is what we need to look at through this particular video. So let me just share that screen, and then we'll have a listen into this brief video. So there's no audio in it for the first few seconds. So let's listen in.
My name is Dr. Nick Harper. I'm a consultant anaesthetist and the Deputy Medical Director at Blackpool Teaching Hospitals. I've worked here for 19 years, and 18 years ago, having worked here for a year, I had to blow the whistle on a consultant colleague's surgical practices because of concerns I had about patient safety. At that time, there weren't any policies or procedures to guide me, and I had very little support in terms of advice on how I should approach the process. I did it to the best of my abilities and was supported by the colleagues within my department, but the wider hospital, there was very little support for me. The organisation itself supported my action, and eventually the case came to a close after 7 years. During that time, I did struggle to get some support, but I was very fortunate in that I was put in touch with public concern at work, who were very, very helpful and supportive. What I was doing was good. And the fact that I had noises around me suggesting I'd done a bad thing was something I should ignore, because the primary focus was upon patient safety. As a result of the case that I was involved with, there were a lot of changes within the organisation. We actually started to put into place raising concerns, policies and procedures before it was actually becoming mandated. And those policies have been in place and been in use ever since that time. I myself have functioned as a kind of beacon for people with concerns as a result of the experiences I went through. So people raise concerns with me quite frequently. And in that sense, I've become the natural choice to be the freedom to speak up guardian. This is an individual that's now in place in every organisation but in the NHS, and is an individual to whom concerns can be raised by anyone about anything where they feel patient safety is at stake. So far, I haven't had any concerns raised to me in this capacity, but I expect that I will in the future, because people do come to me with concerns, almost regardless of my role and title. We need to celebrate individuals who raise concerns when those concerns are legitimate. We also need to ensure that organisations who support individuals raising concerns are also celebrated. My organisation didn't find it easy at the time that I raised my concerns, and it was described as being courageous, although what's courageous about raising concerns when patients are being harmed? I think that moving forward, we're getting a much more open culture, not just in my organisation, but within the NHS and within industry at large. And that can only be good for patients, for people, and for processes.
Okay, so as you can see in this short video, basically there is an example given of, how to respond to abuse. And obviously this particular person, worked essentially and raised a concern, some 19 years back. And at that point in time, there was very little written guidance available in terms of any sort of policy on safeguarding or, any sort of policy in terms of how these concerns have to be raised. And there was a bit of an indifference within the organization when he raised those concerns. And I think because of the work that he did and, the doctor or the person against which he raised these concerns was struck off the General Medical Register or GMC as a council. And, obviously, after that time, this has become a part and parcel of, how the process is looked at internally within the NHS. Now, this gives you a bit of an idea in terms of, how do you raise concern? One of the key things which I guess some of you would have noticed is the process of, whistleblowing. So in terms of, I don't know how many of you caught that term, but when we talk about, whistleblowing, this is a process wherein you refer to the act of reporting concerns or any sort of wrongdoing, misconduct, illegal activity within an organization. And this is usually done by an employee of the organization itself who has the knowledge of the activity or this particular, misconduct happening. And this can be reported as issues like, in this case, it was patient safety, but in general, it could be things like corruption, fraud, safety violations, it could be discrimination, it could be harassment. And in those circumstances, you use this policy of whistleblowing in tandem with the safeguarding policy. And that is what you get to see, that as a process, somebody then raises an alarm. And generally, that alarm is raised by somebody who is internal to the organization, maybe an employee, and that helps detect this particular illegal activity, misconduct, flaunting of guidelines or not following of procedures or wrongdoing, or in this case, misconduct with the patients happening or safety of the patients being compromised. And this process would be the process of whistleblowing. And this is considered as one of the key tools in ensuring safeguarding within the organization or within the health and social care setup, because seldom it gets unnoticed and goes unnoticed that this is happening or this particular part is not normal to what had to be done or should be happening within the organization. So the process of whistleblowing tends to be complex. It is a very sensitive issue. And as he highlighted that he wasn't getting any support from within the organization initially. And this could be seen as, as something quite complex, because sometimes the organization may turn towards the individual itself and the messenger can get shot. So in this case, somebody who comes forward, and how do you respond to abuse or how do you report abuse within the organization? And when we look at going back to some of the things that we discussed very briefly at the start of this session is you make records, you keep evidence, you listen attentively, and then raise concerns with the relevant people and authorities, which allow them to address these concerns, in this case of patient safety. And in most cases, there are now policies and procedures within public sector organizations which document very clearly whistleblowing, and there are various mechanisms available wherein individuals can come forward and confidentially report incidences of wrongdoing, misconduct, or illegal activity happening, which could put, or, when I say it could be related to patient safety, which could essentially put patients into harm way. Now, with this, we come into with a bit of brief background and understanding of, the learning outcome, which is understanding how to report incidents in the case of abuse and harm. Let's look at some of the assessment criteria. So any questions on this so far? Any questions, anybody at this aspect so far? Okay, so let's go into some of the assessment criteria, which talk about, explain what action is to be taken if you, suspect that there is an abuse actually happening. So one of the key things that we need to look at when we, suspect that there is abuse happening, then what we need to look into is look at how do we pick up the signs of, abuse happening within a particular place or with a particular individual. So in this case, if we do suspect that there is an evidence or there is a suspected abuse or actual abuse happening, then we need to be able to take some immediate action. And this immediate action tends to be, to protect the individuals who are being subjected to abuse. So a couple of things that we can look at is, one, we will look at responding to concerns. And these responding to concerns would ensure that somebody who is, when I say somebody, I would mean by that is a care worker or a social services worker, is immediately informed about the safety and well-being of the person. And he or she would then raise and invoke further response from emergency services, or seek medical attention, or seek advice from her or his or her manager to ensure that this is kind of immediately detected. The second thing that we could look at is, if we do feel that there is a suspicion in terms of abuse taking place, then what we need to be able to do is we need to be able to look at observing signs of those abuse and documenting those signs of abuse, which could be later used as evidence. And there, what we would need to do is not start getting into interrogation with the person who's suffering that abuse, but also so as a relevant person, you would not get into any sort of interrogation at that stage. What you're going to do is observe those signs, document them for evidence, and then bring them to the notice of relevant authorities, which at some stage would then, conduct a thorough investigation. Now, what do you mean by observing those signs? We could look at taking photographs, we could look at taking videos, we could look at making written records of what you're observing and what you're seeing, document them with date and time, and that would be quite useful in terms of, at a later stage when evidence has to be produced. In some cases, you would observe and, even physically collect some evidence that could be related to abuse or suspected abuse. And this would then be useful in further investigation that can happen at a later stage by relevant authorities. Now, the other part of the suspected abuse that we look at, if it is happening, how do we look at is, if you are a social care worker and your responsibility is to provide care to that individual and support to that individual, then you would usually be looking at reporting these concerns to your manager or a nominated safeguarding lead, who would then, step in and then basically look at the situation and decide to take further action. In some cases, if these, the nature of abuse is life-threatening or is threatening the health and safety of the individual, then in those cases, you are also looking at, invoking the emergency services by calling 999. And that is where you're reporting, a crime, or you're reporting an abuse, which is very serious because it can lead to, concerns about the health and safety of the individual itself. Now, again, this would be related to one of the videos, if you recall, that we saw with Haringey Council in the first session, wherein an old lady, felt vulnerable and, felt that her life was threatened. If you watch that video, and that would basically mean that she called the emergency services, and then they took relevant action because she felt that because she was in a wheelchair and she was being, her life was put in danger. And she looked at, ensuring that the relevant authorities were contacted, and then the social services team or the care worker raised that alarm, and she felt that she was then protected. So there are concerns that you can raise and actions which need to be taken depending on where and which line of work you're working in. So if you're a social care or a services worker, essentially responsible for providing care to the individual, your main aim would be to observe, document, evidence some part of these things which are happening, which are either suspected abuse or actual abuse happening. You raise it with your manager, and then the manager or the person, local authority, would then take appropriate action. The appropriate agencies would get involved to do a thorough investigation, and in some cases the thorough investigation into abuse, including identifying any individuals who may have been involved or may be related to the incident, would also be looked at, brought to justice. Last but not the least, sometimes you look at reviewing policies and procedures because they are related to safeguarding and abuse prevention. And they are a necessary must because some of these are put into place by agencies like the Care Quality Commission, CQC. And when you look at using some of these policies appropriately, what you're looking at doing is preventing any similar incidents which could have which could be occurring in the future. So what you're doing is observing and ensuring that if you see any suspected evidence of abuse happening, or you suspect that actual abuse is happening, then in those cases, you're kind of using the whistleblowing policy and ensuring that you're informing relevant authorities or people within the organization who would then step in and obviously look at, responding to that abuse. Now, one of the things that we need to do, if you observe that there is suspected abuse happening and there is evidence that is available, then you are required to report that abuse. But in reporting that abuse, what you also need to be able to do is ensure that the individual's safety is not put into harm's way. So in some cases, when you disclose the abuse, you're showing sensitivity and you're providing reassurance to the individual that their concern is going to be taken seriously. If you're not able to make that decision, and obviously you're not authorized to make that decision, then when you inform relevant authorities, your supervisor, your manager, or the local authorities, then they would be taking the necessary steps to primarily look at conducting a thorough investigation. But in this case, one of the clear things that you have to do is you have to show sensitivity and provide reassurance to the individual that, yes, this is being taken seriously. In some cases, when you look at that, yes, there is abuse or there's neglect, suspected abuse or neglect which is happening, then in those cases, you would follow certain procedures and policies which are laid down in the organization, and that would be used in a systematic manner to disclose the abuse or the suspected abuse which is happening. So here the essence is on following the correct procedure. That means you are documenting it, you're observing it, you're preserving the evidence, you're reporting it to your manager and supervisor, or in some cases, local authorities, and they would then be guided by the policies and procedures which are available or are in place to be able to take necessary action because they have the authority. In some cases, it could be the police. In some cases, it could be the local authorities delivering the social services. And in some cases, it's the regulator themselves, which is looking at institutional abuse or ignorance of the abuse and acceptance of that abuse happening within an organization. And that could be at the regulator level, wherein CQC steps in, puts that particular organization into, monetary mandate, observation, and then restricts and monitors some of the operations happening to ensure that thorough investigation can take place. And these tend to be the ways in which you primarily look at, as a social care worker, documenting and taking wherever possible suitable action to document suspected or actual abuse. So what I've done is for each of the areas like responding to concerns, I put some slides in, responding to actual alleged abuse, I put documenting or preserving evidence. So obviously, how do you document evidence, which is through photographs, through, for example, videos, taking some written records or noting down key times and dates and key points which are highlighted by the person who's undergoing or is subject to that abuse, and those would be the areas that you would primarily get into to understand and document and then preserve and then respond in terms of ensuring that you are able to take the essential action which is required to be able to prevent any abuse happening, or if you suspect abuse happening, then you bring it to the knowledge of your relevant authorities or your superiors. Is that okay? Any questions on this so far? Okay, today everybody is awfully quiet. So if you have any questions, if you don't understand anything, please feel free to ask me. Now, the second assessment criteria that we want to look at is evaluate the role of practitioners, and agencies in safeguarding. Now, what we want to be able to do is what do you mean by practitioners? Anybody, in terms of what is meant by the term practitioners? What are practitioners? Any idea? So practitioners, when we talk about practitioners in the health and social care sector, these are people or professionals who work within a particular field. In this case, we are talking health and social care. They have specialized knowledge, skills, and experience related to their area of work. So when I talk about practitioners in the case of health and social care, in particular, if I just say, for example, talk about this particular sector, health and social care, then in those cases, when we talk about practitioners, these practitioners tend to be doctors, they tend to be nurses, they tend to be pharmacists, dentists, social care workers, therapists. We talk about, people who are psychologists, people who are dealing with substance misuse or abuse in terms of alcohol, those people who have specialist knowledge, skills, and are considered to be expert in this area of health and social care would be termed as practitioners. Now, when we talk about, in particular practitioners in the case of social care, for example, what do you mean by social care? How do we differentiate it from, general practitioners? So when we go to surgery, hospitals, A&E, any community-based service center wherein medical services or social care services are provided, then in the context of practitioners in social care, we talk about social workers, we talk about healthcare assistants, we talk about occupational therapists, we talk about physiotherapists, we talk about nurses, care assistants, and health visitors. So, for example, if somebody has gone through the process of, has been pregnant and have gone through the maternity process, then you would generally see your health visitors coming for a couple of weeks after you've had the delivery to your house to look after you and the care and provide care to you and the newborn child. And in those cases, those are people who are basically health visitors. So professionals who work with families and young children to promote their health and well-being, especially after conditions like maternity or, in this case, after pregnancy, then they would be termed as health visitors. So when we talk about role of practitioners, we need to be very clear, what does the term practitioner mean? So practitioners, when I go to a GP surgery, a doctor, a nurse, a clinical nurse, when I go to and get social care services, or when I get services through the local authorities, through the community care centers, then in those cases, we are referring to social workers, we are referring to, nurses, care assistants, and obviously health visitors. Now, when we talk about agencies who are involved, who are the agencies involved in terms of, providing these, let's say, social care services, or in general involved in providing safeguarding. So when we talk about the agencies involved in safeguarding, what we want to be able to talk about is, in different countries, obviously there are different setups, but specifically looking at UK, we would look at agencies which are involved in safeguarding would be social care services, local authorities, we look at healthcare providers, we look at mental health services, and we look at, advocacy groups, which are basically voluntary organizations, and then or non-governmental organizations which will be involved in raising awareness. So when we talk about PHE, Public Health England, that is an organization which is primarily responsible for raising awareness, about the concerns around safeguarding, or, how do we support the victims of people who have been, who have been abused or have faced neglect, and then legal services to a certain extent, because there are professionals who work within this sector to be able to help get people who have been abused or have been put in the harm's way because of neglect, abuse, or exploitation. Then they would normally work with the authorities and the individuals to be able to get compensation, and they would be involved and providing them through the legal services route, making the person aware about their legal rights, their interests, and in some cases also looking at representing these individuals in court to be able to get compensation. So in general, before I get into details of this assessment criteria, what I will want to do is make sure that you understand practitioner, the word, and the agencies as a word. So who are practitioners? In the health and social care sector, we are looking at health visitors, nurses, care assistants. We are looking at social workers, occupational therapists or physiotherapists, people who help people working with disabilities, and they would be involved in providing these healthcare services. When we talk about agencies, there are lots of agencies, but specifically in the context of safeguarding, we would look at agencies which are primarily involved in law enforcement, healthcare providers. We look at mental health care services. We look at advocacy groups, which are charity or voluntary organizations, and obviously some part of it would be related to legal services if at all the victim retorts to seeking compensation because of neglect, abuse, or harm or exploitation they faced. Now, in this assessment criteria, what we need to be able to do is understand what is the role of practitioner and what is the role of safeguarding agencies. So one, when we look at going into the role of practitioners, we will look at that practitioners and agencies are obviously going to play a very important role in helping protect individuals using safeguarding as the umbrella. So when we look at safeguarding as the umbrella, I don't know, just very briefly, let me bring an image across from the first presentation. I had shown an umbrella image, and that umbrella image was essentially an image which helps us understand what this would, if you recall this particular image that we had discussed in the first learning outcome, is the umbrella under which safeguarding is provided to members of public, either children, young children, vulnerable adult, or people with disabilities. So what is the role of agencies and practitioners? Their role would be covering to help protect individuals under the safeguarding umbrella to ensure that they are not subject to sexual, physical exploitation, emotional neglect, financial, institutional abuse. And this is what tends to be with the role of, in a summary, if I have to say, the role of practitioners and agencies in ensuring that they do not undergo any sort of, abuse. So one of the key roles that the individuals would be playing, or practitioners in this case, which could be care workers, health visitors would be doing, is observing and noting down the signs. If they feel what are the signs that they're observing for abuse, and they would then be reporting it to relevant authorities, maybe your manager, maybe the relevant authorities, or maybe their supervisors. Then once it has been reported, what will then happen is at some stage, this particular bit would be taken further through thorough investigation, and at some stage the agency would get involved. That would mean social care services, local authority, the council. In this case, when I talk about social services, I mean by that is our council would get involved, people in the council would get involved who are directly related to providing that particular service, and they would then start to conduct thorough investigation. Once the investigation is being done, they will also look at prevention of further abuse or neglect or harm being done to the individual. And in those cases, they will also then look at providing appropriate medical services, mental health care services, offer counseling and therapy in some cases. And this would be an example of what the role of the practitioner would be. Sometimes we get to hear in the news that, so-and-so has been murdered, or so-and-so has not, the body has not been found. And we see this in the news quite often. And you generally see where there's a local authority or the agency step in, which is, when I say local authority, I mean the council, the police, and some of the other services step in, health and social care services, they offer support through therapy, or counseling to the members of the family because they've lost somebody, a very near dear one in their family. They've had a sudden loss and they don't know how to, comprehend that loss. So in those cases, the council, the local authority steps in by arranging and providing mental health care, offering counseling and other services so that the individuals in the family can actually cope with that particular loss that has happened, or try and manage the situation in terms of coping with that loss which has happened, which is an untimely loss which has happened. And that would be intervention, an example of intervention and support, which would be done by the agencies involved in, providing these services. You have legal and regulatory action. So in some cases, when safeguarding is not being done to the standards, you would generally see legal and regulatory action happening. CQC steps in, the Care Quality Commission steps in, it restricts funding, it puts sanctions, it basically starts an audit of that organization. It looks at documenting evidence to see if there is a systematic trend of abuse happening within the organization. Interview and thorough investigations would be taken place, and obviously some of the services which the organization provides may even be restricted, and the organization may be asked to shut down if the abuse is serious and has caused concerns about health and safety of the individuals receiving those services. And legal action could also mean criminal charges when police gets involved, and obviously legal services side of things, ensuring that people working within this sector also are regulated. They have the relevant certifications, training, and in some cases, some organizations would even be losing their license because CQC feels that these errors or lapses which have happened in delivery of these services are non-compromisable, and in those cases, the authorities would revoke the license of that organization to be able to offer those services in the future. We also look at prevention and education. One of the key factors, training and development, that we look at, I think prevention is better than cure. So obviously, when we look at training and development happening, and obviously raising the awareness of how abuse can be prevented, how abuse can be spotted, and people being put in the harm's way can be spotted, and that can be done through education and training. And in those cases, education and training leads to what is called raising the awareness level of individuals working within that organization, and thereby ensuring that healthcare providers, people or practitioners who work within this sector are able to systematically be trained to pick up signs of abuse, neglect, or harm, or some sort of exploitation happening, and they are then able to raise alarms or raise this concern with relevant authorities in order to ensure that this abuse does not happen. Now, the government in the UK has also formed what is called the SAPs, Safeguarding Adult Boards. Now, these are boards which have been established within the local authority, in the council, local council and authorities within a particular town. And here the SAP representative is a person from the local authority, and this particular board consists of, as a body, it consists of a representative from the council, from the police, and from the CCG, which is the Clinical Commissioning Group. So when we talk about, CCG, I don't know in terms of how many of you know what is CCG, but CCG are basically clinical commissioning groups which are responsible for planning and buying healthcare services for the purposes of providing them to the local population. So if I look at in the Manchester area or in the Greater Manchester area, there will be a lot of different CCG groups which are under the Department of Health, and they are basically made up of a group of general practitioners, GPs, healthcare professionals, whose main work is to basically commission and ensure that high quality, cost-effective healthcare services are provided to members of public. So when we look at setting up a surgery, how many patients the surgery would be able to register, what kind of services it would be able to provide, how many surgeries are needed, these are all going to be decided by the CCG groups in a particular area. And I think, to the best of my knowledge, if I look at how many CCG groups are there in England, I think to the last count, when I looked at the Department of Health, organization chart, I think in England, there are 135, CCG groups. Obviously, there are other governments which are devolved. So Wales, Northern Ireland and Scotland would have their own. But CCG groups in the UK in particular, when we specifically talk about England, it is worth noting that there are 135 such groups, and they are currently being replaced by what is called the integrated care system groups, which now are being, given the responsibility to plan and deliver healthcare services across the various areas. Now, some of the reason I put these slides on is what I wanted to do was highlight some of the key agencies which are involved in the delivery of, safeguarding services. Then we have social services, which look at investigating concerns relating to safeguarding of vulnerable individuals. They have the power to be able to implement interventions. They can prosecute, they can stop these services. They can, they have social services have the option to take away and protect the individual's rights, and obviously ensure that the services being provided properly. So sometimes you see if parents neglect their children and systematically abuse them, social services can take away children and put them into foster care because they feel that the children are not protected with the parents. And in those cases, there will be several concerns or signs that will be raised for safeguarding. And before that final action of taking the children away can happen, as an example, and that would be an example done by social care services. You have health and social care organizations. These tend to be putting, people in place which will basically be providing services to people who require them at their doorstep. That means at their home. And they would be people who are healthcare visitors or care assistants or nurses, which will be a part of the health and social care organization or the part of, a larger part of the GP surgeries or the hospitals. And their aim would be to provide some of these services to individuals at their place of living. And in those cases, they are also trained to be able to spot, neglect, harm, abuse, exploitation happening. And they are very well trained in the safeguarding policy, whistleblowing policy, and how to look at doing risk assessments when they visit, people's home. And the last is the regulator itself. When we talk about, CQC and the police, obviously their role is to regulate the health and social care services. They monitor, they can revoke the license, and they can put sanctions, they can take away funding, they do inspections regularly in a year, once in 3 years, or are responsible for providing licenses to institutions which are able to provide these services to the members of public. And if we do feel that some of these land into the area of criminal charges, or charges need to be raised because the concerns are quite serious, wherein it leads to let's say harm to the individual in terms of health and safety, that means harm to the life of the individual, then in those cases police could also be involved, or the local authorities and the regulator could also inform the police to take appropriate action. So this helps us cover this particular assessment criteria, which is looking at the role of practitioners and agencies with regards to their role in safeguarding. Any questions on this so far? Okay, so if there are no more questions, what I'm going to do is obviously end the session today. And then there are bits that you can do a bit of further reading on, which is further reading given in the plenary slide on slide 14, which talks about recognizing and responding to domestic violence and abuse as a case in point example for understanding this learning outcome in a bit more detail. We'll catch up tomorrow, or I think there is a session which is scheduled for tomorrow, and tomorrow we'll be looking at covering, learning outcome 3, and that session is at 4 p.m. tomorrow. So see you then. Take care. Thanks for attending, and bye for now.
Rama.